If someone comes in with issues that might be involved with how long that person stands every day, you got to ask the patient, when do you feel your aches and pains in your body? Is it more when you first wake up in the morning or later on in the day? And then do you stand all day or do you stand a lot? So if you were to look at, issues, ankle, knee, and hip, as well as back problems, often enough stem from the feet. Hi there, Carl Rothschild here. I'm going to be talking today about standing. I think you might be surprised at how many patients came into my office and their issues were from being on their feet all day. So the first thing that I do, and I think any health practitioner should do, is if someone comes in with issues that might be involved with how long that person stands every day, you got to ask the patient, so, when do you feel your aches and pains in your body? Is it more when you first wake up in the morning or later on in the day? And then do you stand all day or do you stand a lot? If someone doesn't walk and stand much throughout the day, then it's not as big an issue. But even so, if you look at the left healthy foot versus the right flat feet, this is what we're mostly looking at. And both of them need to be supported. The one on the left should have nice supports, orthotics or arch support in their shoe. Same thing, the one on the right, which is flat feet, even more so, they need support in that foot. So if you were to look at, issues, ankle, knee, and hip, as well as back problems, often enough stem from the feet. So we always look at the feet, and you'll see the title of it is All Starts with the Feet. Now, I wanted to get heels out of the way right from the get-go. They're going to create problems. There's no question about it. The front musculature of the leg is going to be stretched out, and the back musculature of the leg is going to actually be tightened and shortened. So what they mistakenly do is when they get home, they go ahead and wear flats, and that is really bad. You don't want to go straight from high heels. If you're just wearing them for 5 seconds, no problem. But if you've been on your feet a long time in that day, walking and or standing with high heels, you don't want to go flat right away because that's very difficult on the body. And they used to promote this thing called negative heels, where the heel of the foot was actually lower than the toes. Oh my God, we got so many new patients from that, from women in particular, because these were so bad. But flats also are not a good idea. You see, the foot naturally looks like this. When you just let it relax, the toes are actually lower than the heels. So what you want to do is to wear a shoe like a pump like this, which has a 2-inch heel. And I know this is not as beautiful as high heels, but this is what makes sense. If you've been wearing high heels all day, then you transition to wearing pumps. Now, again, since it all starts with the feet, this is what it looks like from the back when someone has flat feet. And I'm telling you, their feet are all screwed up. If we put a nice arch here, everything straightens out and it's much better. Now the question is, what kind of arch? So whether the person has flat feet or high arch, we want to make sure that they have their arches well supported. So let's talk about orthotics. These are things that some professional probably would prescribe for you to put in your shoe. And the podiatrists in particular, and I've worked with a lot of them, they like hard arches or orthotics, and we created all kinds of problems. It's hard to get used to. Chiropractors have always dealt with leather inserts, which is much easier for the person to get used to. So you want to have softer orthotics in there and gradually increase time with the insert. So, you just got your whatever orthotic today, and tomorrow you're going to go to Disneyland and walk all day. Not a good idea. You want to have a generic good shoe, but don't put in these specific arches right away. So you can put them in, wear them for 5 minutes the first day, expand that eventually that you can wear them longer and longer. So the impact of arch support on pain relief is that 78% of individuals reported a decrease in foot pain after using arch support. 42% noticed a reduction in low back pain experienced with individuals with the proper arch support. And 91% noticed improvement in overall foot comfort with the use of arch support solutions. So I'm a big fan of arch supports. So one of the things that comes up is plantar fasciitis and eventually heel spurs. And the way it looks like on an x-ray is it actually looks like there's a bone here that's been growing. And that's not what this is. What happens is over a period of irritating the heck out of this fascia, and this next video is going to show you how that happens, it starts laying down a layer of calcium to kind of protect the insertion right here. And over a period of time, it creates what looks like a bony spur. And when it gets to that point, you really let it go too long. So let's just watch this video real quick. The plantar fascia is a structure made up of connective tissue on the sole of the foot that supports the arch of the foot and plays an important role in the mechanics of walking. When the foot is in a position known as plantar flexion, which means that the toes are pointed down like a ballerina, the plantar fascia is on less tension. But when you take a step, the plantar fascia tightens up under tension. Sometimes the plantar fascia becomes irritated and inflamed at the site where it attaches to the heel, the calcaneus. And this condition is known as plantar fasciitis and can lead to heel spurs. While sleeping, the foot usually rests in plantar flexion, but upon the first step after getting out of bed, the plantar fascia is rapidly stretched. This places extra tension at the attachment of the plantar fascia to the calcaneus, and so plantar fasciitis often causes the most severe pain upon getting out of bed in the morning or standing after sitting for a long period of time. Let's review. First of all, you know that I feel the feet are pretty important. So the feet serve as the foundation of your posture and can significantly affect your daily activities. So here's some tips. We talked about lowering your heel. So if you're not really ready to give up your high heels entirely, give them a break by switching to lower heels, not flats, not barefoot even. And also thicker heels are better choice than stilettos and offer more even weight distribution. The next thing is about flip-flops. Flip-flops can be a good choice if you're spending the day at the beach or hanging around the house, but they shouldn't be your go-to shoes. You're more likely to develop back pain or injure yourself if you wear flip-flops every day. Now, I already talked to you about arches, inserts. If you're buying tennis shoes, they should have phenomenal arches in them. Not that they ache, they should be soft. But you want to get, if you're going to go to a health practitioner, I suggest go to one that's offering soft orthotics. The inserts provide arch support, keep your feet properly aligned, reduce foot movement, and provide extra cushioning. So when you go to the shoe store, I would ask the salesperson to measure your feet and get the right shoes for you. If you have a wide foot, like an E or double E, don't try to fit into a D. A lot of people, what they'll do, for example, let's say you're a 9 double E, they'll get a size 10. And it's just not the best thing. So try to find proper shoes that come in wide if you have a wide foot. And if not, just remember wearing the wrong size shoes, whether they're too big or too small, can be a factor in gait issues as well as aches and pains that can occur throughout the day. And then avoid tight shoes. And this kind of goes to the same thing. They can increase pressure on your feet and can affect alignment and gait. So just make sure your shoes offer a little wiggle room in the toes. So I really appreciate you watching this video. I hope it's helpful. If you have any positive things to say, please comment in the YouTube channel. Thanks so much and have a great rest of your day.